Hello, ATH Ellis. Welcome to another episode of Abby's Daily Dose. My name is Abby, your healthy living MP. How are you guys doing? Hope all is well. June is Men's Health Month, and I just wanted to give a few tips on men's health. This is going out to all the men and women, also our husbands, brothers, fathers, adult sons, and all that, men who you hold dear in your life. These are just a few tips, okay? I'm gonna put the videos that I made before in the comment section of this video. All right, so let's get to it. Men, it's important that you go see your family doctor at least once a year. Okay, so get your physical so we can ask you questions about your health, your history, and all that. We get some blood work done, get your vital signs, your blood pressure, your heart rate, all of that, temperature, all that taken. Because you can say, I'm fine, there's nothing going on with me, I don't need to go, and all. We're checking for your liver numbers. We're checking to make sure you're not diabetic. We're checking for your kidney numbers and all the those are the things that don't have any symptoms until it's way too late or to where we have to treat you. I know some people are not too crazy about taking medications and all that. There are times that you can't help with the taking medications just so, but it's important that if we can prevent it or delay as much as possible, it's important to do that. And we talk about your heart health too, okay? Because your heart health and your brain health also kind of go together. So it's important that there's some doctor's office now are doing like baseline EKG to make sure everything's going on there, because sometimes the first sign of a heart attack is a heart attack. The first time of a stroke is a stroke, and it can have debilitating and devastating effects that can change your life and your livelihood for you and your family. So it's important that you catch those things way ahead of time. Doesn't mean that things not going to happen if you do go and all that, but I'm just saying that's preventative care, and you can get it ahead of time. This most important thing is preventing things before they happen or delay them or be able to treat them as soon as possible. Okay. Also, for men, you need to get colon cancer screening too. Now you had a colonoscopy where you drink the prep and then you go down and put your little light anesthesia and you have the procedure done. You go up your rectum and have this procedure done. I know some people may say it's not that comfortable and all, but you drink the prep. It's gonna be a little bit gooey, but you drink it and you get the test done. They check there to make sure you don't have anything going on. If there's anything there, they're called polyps and what's kind of growth, precancerous growth, they can take it out, and you may not have to go back there again for another year. And most times it's like 5 years or 10 years. Important. The actor Will Smith, I think I talked about this before, where he was just doing it just to show how men should go to go see the doctors and all that. And luckily for him, he had that done. If he hadn't had a colonoscopy done, well, he was just doing it just to encourage men to go, he would have been dead like within 5 years because they found some polyps and all. And we also talk about, the guy from the Black Panther too, right? You saw how young he was. And within at age 44, he had already passed away from that. So it's important that you go get yourself. Now, some people might say, I can do it at home. Your doctor will determine whether you had anybody with colon cancer before, or depending on your other risk factors and all that, your doctor may determine that, no, let's do it. Most doctors want for you to have a colonoscopy now, but if you can, absolutely can do it, because there could be other reasons why you can't do it. Yes, they want you to have you do it at home. So once you do the one at home, they send it to the lab, and then they call your doctor's office, and if it's negative, you don't have to do it for another 3 years, depending on if you don't have any symptoms during that time. But if it's positive, doesn't mean you have cancer. They just mean that you need to have the test done. Okay, so it's important. Usually that's age 40. All right, most of the things are like age 40. And also going in your prostate health. All right, I told you it's the gland that's in the groin area that also controls your ability to urinate. Also, it kind of with your intimate life and all. So when you go into the bathroom, you go to the bathroom and the stream just supposed to go right down. Just imagine, just go right down into the toilet. That's the way it's supposed to be. But when you get to a certain point, as you start getting older, you start, or even younger, like age 40 or so, you start to, you shouldn't be drip, drip, drip. It shouldn't be like, I have to go to the bathroom right away. I have to go to the bathroom right away, especially if you're not on any medication that makes you have to go to the bathroom right away. And, or if you're going and you're not feeling empty enough and you find yourself having to go more, urgently and frequently, okay? So bring that to your doctor's attention, all right? Because they'll have to do your PSA level. That would be doing your physical and all when they do your initial blood work. Sometimes it may be elevated, but there's something that we look at also that says, okay, this range is a little bit too high. Depending on that and your medical history and your family history and all, they may want to do additional testing to, so we're not looking at anything like prostate cancer. Prostate cancer, especially one of the biggest signs for prostate cancer is You should not never have any blood in your urine. Now you may say, okay, I don't have no pain. I see a little bit of blood, but I don't have no pain. That's one of the telltale signs. All right, we call that painless hematuria. You should never have any blood in your urine. Does that mean you have cancer? No. It could be like you're very dehydrated, or you're taking some kind of medication that affects that and then goes past the blood in your urine. But it's important that you bring that to your doctor's attention. Okay. So eating healthy, make sure you're eating healthy, cut back on alcohol. If you smoke, call 1-800-QUIT-NOW, so they can give you different resources on how to quit, because smoking and alcohol leads to liver damage later on. And also, smoking can also lead to heart disease and all of that. Okay, so exercise at least 30 days, 30 minutes a day, at least 3 times a week or more. You can go walking, jumping around, exercising, playing sports or whatever. Just make sure you keep as much as, stay as healthy as much as possible, okay? But it's very important that you follow up with that, and you want to be around for as long as possible to be healthy and happy with your family. So it's important. We love the men in our lives, all right? So we want to make sure that they're healthy, all right? So again, I'm going to put some videos in the comment section of this video, and you guys can go back and watch that. In the meantime, stay healthy. We love the men in our lives. Thank you all for the love and support, and I will talk to you guys later. All right now, bye-bye.